first exercise that we will be looking at today is the air squat. The air squat is a foundational exercise that should be done by anyone of any age. The muscle groups that are involved are the quad muscles, the hamstrings, the glutes, and the calves. In order to do this activity, it all starts with squeezing the glutes and abs in order to maintain proper spinal alignment. Next, you'll begin by hinging at the hips and then slowly breaking at the knees until going as low as you possibly can without rounding at the back or breaking proper spinal alignment in any way. Some common errors that are seen in this exercise is a rounding or also a hyperextension of the back. This can be corrected by squeezing the glutes and abs throughout the whole exercise in order to maintain proper spinal alignment. Another common error that is seen is having the feet flare outwards to make up for a lack of hip mobility. This can be corrected by strengthening and stretching the hips. The next exercise that we'll be looking at is the walking lunge. This exercise is a great split stance exercise that will work your hamstrings, your quads, your glutes, and your calves all simultaneously. To start this exercise, you are going to want to begin by squeezing your glutes and your abs to ensure a neutral spine position. To start this, take a step forward with either of your legs, and then with the stationary leg, drop your knee and your hips down in a straight line, and then use the leg that is extended outwards to push yourself up and back. A common error that we see is that people have a tendency to have their knee extend over their front foot. This can be corrected by watching yourself in a mirror and monitoring the position of your knee in relationship to your foot. One of the most common errors that we see is that people have a tendency to show knee valgus as they go through this motion. This can be corrected by doing knee stabilization exercises. The next exercise that we will be looking at in this video is a single leg side squat. This is a very complex single leg squat with a side reach with the outside foot. The main muscle groups that are going to be used in this exercise are the quads, the hamstrings, the glutes, and the calves. But also muscles around the ankle and the knee will be used for stabilization along with the core and hip complex muscles. The way this exercise is performed is very similar to the squat. You begin with a hip hinge and then breaking at the knee. While this is going on, you extend out with the leg that you are not using to squat. The two most common errors that we see are knee valgus and ankle eversion. This is due to an instability in the knee and ankle joints. This can be remedied by performing stabilization exercises for both the knee and the ankle. The next exercise that we will be looking at is the push-up. This is a very popular vertical push exercise that can be done by almost anyone due to modifications. The muscle groups that are going to be involved in this exercise are the pectoralis major and minor, the triceps, the core, and part of the deltoids. Start by squeezing your abs and your glutes to ensure proper spinal alignment. Then lower yourself towards the floor. Then begin to push yourself up from the floor using your pecs and tricep. A common error that we see in the push-up is having a flaring out of the elbow. This can be remedied by keeping the elbows as tight to the body as possible. Another common error that we see is seeing the back in a arched or globally flexed position. This can be corrected by squeezing the abs and the glutes in order to maintain proper spinal alignment. The final exercise that we will be looking at in this video is what is called a standing row. This is a great horizontal pull exercise that can be done anywhere. The muscle groups that are used for stabilization are the quads, the hamstrings, the glutes, and the core. The muscles that are being actively used during this exercise are the lat muscles, the rhomboids, and the biceps. How this exercise is done is you anchor some sort of resistance tubing or cable to an anchor and then get into a half squat position. Once there, you begin by contracting the scapula and pulling it together.